people get right service at right time at right cost.
और हम सब जानते हैं जमाना बड़ा तेजी से बदला है। आज के युग ने ऐसी इक्विपमेंट को इजाद कर दिया कि वो बीमारी को ढूंढते भी हैं और बीमारी का इलाज भी करते हैं।
Respected DG Health Services, Dr. Jagdish Prasad, dignitaries on the dais, other esteemed guests, management and staff from Elite's magazine. First of all, a big thanks to Elite's for bringing us all together here. I can see that from public sector and private sector and even from civil societies, people are participating in this conclave. So I am here to present some of the IT initiatives and efforts taken by state of UP over last couple of years. So as we all know that IT is a very important tool now in hands of government or private sector or anyone who is supervising or who is implementing any kind of program. So this will be my outline of the presentation. I would be first talking about why this IT initiative and why do we need this IT intervention. The things which come to my mind, I have, these are 4-5 things which come to my mind, and I think these are the most important factors which push us to introduce or to use IT in implementation of our program. One of the thing is like IT provides us an opportunity for delivery of services in a transparent and time-bound manner. Other is certainly this is an effective monitoring tool for administrators like us or who are sitting in a state or government of India. This now we are so many projects we are implementing under PPP model, and when you are hiring some private service provider for implementing a project, then certainly you need IT tools or different tools to monitor the progress of the project and essentially the contract management part of it. The other thing is certainly improving efficiency in implementation. Whoever is implementing our program in the field, if we are providing IT tools in their hand or we are monitoring their progress through IT, then certainly it's an opportunity to monitor their progress in a much better manner. Other thing is, of course, supply chain management and inventory management. We are providing drugs from state level and it's going up to the block level, and different kinds of drugs we are supplying to the field. So for managing and for having an inventory control over this thing, we use IT tool. Now, this is one information system which has been developed in-house, and this is totally done by our UP HSSP team. It is UP Health System Strengthening Project, and this is a World Bank funded project. The main objective of this patient diagnostic information system, this is a tool to monitor our contract where we are providing 150 high-end diagnostic services through private service provider in 50 different district level hospitals. So when we were formulating our RFP, then we thought that it would be prudent to have our own software system to monitor this project. And like in this project, 80% the service providers are getting 80% upfront payment after producing invoice, and 10% is based upon the turnaround time. What is the time taken by the service provider to upload the test results on the website, and 10% is based on the EQAS, the external quality assessment system. So we certainly needed a IT tool to manage this contract. And as you can see in the first bullet point, that this has been developed in-house, and this is totally integrated with the live information system of all our private service provider. This is like when a patient is referred by CMS to the collection center, which has been established in our premises. This is the patient profile registration page, where all relevant detail related to patient, their identity and their address. This all gets entered in our information system, and it gets logged. So after the sample is taken, how much time is being taken by the service provider to upload the test results? Through this, we are calculating TAT, and depending upon the TAT compliance, they are getting payment from that 10% which has been earmarked for TAT compliance. The patients are getting all kind of information, what are the tests which are getting performed through the system, and where are those hospitals located, how much government is incurring cost for managing this thing. And then for citizens, apart from this thing, the best part is that they can download the test results. The test results are being uploaded on the website, and the public this is totally in the public domain, and public can go, they can feed their mobile number, and through their mobile number they can download the test results at their own. There is, like we have prepared this presentation in very short duration. So, and for hospital superintendent, of course, he can he can do the doctor-wise analysis. What are the tests which are getting performed, and which is the number one? Like we can also see that whether this is lipid profile or this is thyroid test, which test is getting performed frequently in our hospitals. And through this provides us a tool to manage it in a better way, and to look further that why is that this particular kind of test is getting performed regularly. And for authority, like the contract managing authority who are sitting at the state level, we are managing TAT and EQUAS compliance through our this software system. We are making payments through this system. And for service provider, this is providing some, like when all data is getting entered in our software system, then the service provider is also guaranteed that he will be getting 80% of the payment for whatever test is getting uploaded on the website. At least he is sure of getting that 80% payment. So I think that this has provided benefit to all the stakeholders in this particular PPP project. And this is our dashboard, where many informations are available in the public domain, and public can also see that which are those hospitals which are performing better compared to others. And certainly this is a tool in our hand. We can do age-wise analysis, whether this is male, female, which are the which category of patients is coming to our hospitals and getting these tests conducted. So already more than 1 and 1.5 lakh patients and persons have benefited from this project. Next, I will talk about M-Sehat project. This is like we already know that government of India and all state governments are making effort to control this IMR and MMR. We are far below the number which is envisaged in our sustainable development goal or anything like that. Like MMR for UP is 258, which is pretty high. So through M-Sehat, we have provided smartphones to ASHA and tablets to ANM. They are going into the field. They are entering they are entering all kind of information on our smartphone and tablets. Like ASHA has already entered all village health register, which is like all details of all eligible couples have already been entered into this website. And the moment ASHA registers any person or any pregnant lady, say any pregnant lady in her smartphone, then it gets validated by ANM in her next visit. So if we integrate this with our MCTS portal, that is MCTS portal is a portal that is owned by Government of India. So we can have full details about what are the percentage of mother or child they are getting registered in our website, and whether we are reaching to what percentage of women we are reaching, and to what percentage of women we are providing ANC. Say in the government, in a state of UP, it is estimated that about 60 lakhs of women get pregnant every year. So through this website, through this project, like at present, this has been launched in just 5 of the district, and we have 75 districts. So this is just less than 10% of the whole state of UP. But certainly this is a pilot project, and through if we are successful in having this thing, then certainly we will be in a position to launch it across the state. So this is like our dashboard, where we get all kind of information about the number of ANC conducted in the field, whether they are getting iron folic tablets, whether they are getting abdominal, whether we are conducting abdominal checks or not. And this is again, this is a screenshot of HbA1c report, because like Government of India has also mandated that every ASA, he has to visit all such women who have delivered for next 42 days after the delivery. She has to make at least 6 visits, and she goes to their home, and she checks all kind of, there is a fixed checklist where she checks whether the child is doing well or not, is there any kind of problem with the mother or not. So this is like this childbirth, what is the child's weight, how many childs are in low birth weight, and then if we are finding that these many childs are low birth weight, and whether the ASHA is referring those child to SNCU, that is sick newborn care unit or not. So there are many kind of monitoring or supervision which we can do through this MCR portal. Now this is our third thing. This is a biomedical waste management system. This is again, I think UP must be one of the pioneer state which has launched this biomedical waste management system. Our system, like already most of the hub facilities were entering into contract with CTFs, but they were not knowing that whether this biomedical waste is getting lifted or not. So we have introduced this system, and we have again formulated a comprehensive RFP, which we are floating for all of the state. And here our system, it captures many information. It is already getting implemented, whether the CTF, they are sending their vehicle or not, if there is a certain frequency, whether the biomedical waste is getting lifted according to that schedule or not, and how much waste is getting lifted every day. So all kind of information is there. There is information about hospital profile is there, CTF information is there, and consumable, there is also a problem of consumables, because in our state, in most of the contracts which were entered by CMS or CMO level, the ownership or the responsibility of supplying these consumables were vested with service provider. PS system in all our vehicles that is operating in the district Kanpur, and here we can see and we can track the vehicle movement. We can also know that exactly the service provider is coming to the hospital with a handheld device, and there he can measure the exact biomedical waste which he is lifting from the site, and he is entering the detail, and it is again getting fed into our website portal. So there we can manage and we can monitor this biomedical waste project in a much better fashion. So at present, this help we will be trying to scale it up to across the state within this year itself. Next. This is again a quality assurance management system which has been developed again in-house by our people from UPHSSP and NIC and SIPSA. So, like as I have told you, that UP Health System Strengthening Project is a project, it's a World Bank aided project where we are trying to get NABH accreditation for 50 hospitals. So when we are doing this project, we have to, like, the first step is getting gap analysis conducted in our hospitals. So we have to have this quality management information system. So this was developed due to our that requirement, And this has like all details about, we have posted hospital managers to review this thing. So we already have 50 hospitals manager which are there in hospitals. They are supporting CMS for doing all kind of non-clinical administration. So we have deployed like different paramedical staff and specialists, whatever the gap was there, that has been provided under this project. So we are keeping a tab over the HR, their training and their attendance through this management information system. Their training schedule, whether the training calendar is being adhered at the district level or not. Apart from this, there are gaps related to infrastructure. We are doing civil work. We are providing equipments to those hospitals. We already have a detailed hospital report card. Sir, as you were mentioning that the government of India is also launching this program where a person sitting at any corner of the district, he can see that what are the doctors, and he can see the name of the doctors and what is his qualification. So you would be pleased to know, sir, that we have already introduced this thing in our state. That is called hospital report card, and that is not there in my presentation, but a person can see that what are the IPD, what are the instruments and equipments that is available in any particular hospitals, how many X-rays are getting conducted, what is the X-ray machine that's a specification, whether the dialysis is being done in that particular hospital or not. So all kind of information is there in hospital report card. So coming back to this quality information system, we have this infrastructure details are there. We are also getting grievance redressal through this thing. And we have like got 3 entry-level assessment certification for 3 of our hospitals at Gautam Buddha Nagar, that is Noida, Gorakhpur and Aligarh. So like when the assessors are visiting our district level facility, then they are pointing out certain defects or certain gaps which have to be filled. So we are monitoring those progress through this website and through this information system. We are also monitoring performance of our hospital manager. This is again, drug procurement and inventory control management system. This has been made by NIC and jointly with UPHSSP and NHM team. So through this, we are monitoring our drug supply, and we are going up to the block level. All CMOs, they have been directed that whenever they are placing any order, it has to be placed through this system only. So the moment the CMO is making any purchase order, it is getting to the that suppliers, it is getting directly, it is getting fed into the suppliers web portal, and he is getting this information that this order he has got from a particular district or not. And then the whole supply management, the dispatch of medicines, the dispatch of drugs from the supplier side to the CMO side, and from the district level to the block level, it is getting monitored through this website. We are also monitoring the payments made by CMO to the supplier through this website only. So these are some of the screenshots from our website. And there are a number of applications, because as I've already told you that UP now, state of UP, for every like new projects which we are entering into, we are using IT tools to monitor and to supervise those projects. This is like cleaning and gardening outsourcing monitoring. Again, in UPHSSP, we have outsourced our cleaning and gardening to different service provider. So to manage and to monitor this thing, we have made our in-house software. So again, from like daily data up to payment done to the service provider, this is all getting monitored through this website. Construction work monitoring we are doing through our in-house made software. Next. This is like one of the software which we are in the process of making, and this will be launched. We are hopeful to launch it by 15th August. So through this, as you know that Government of India has, through their support in NHM, we are providing 102 or 108 or different dedicated ambulance services to pregnant ladies or for moving persons or moving patients for inter-facility transfer, or so like to track those whether the we already have more than 2,500 or about 3,000 ambulances which are operating in the state of UP. To track those vehicles, whether the vehicles are on road, off road, and whether they are to avoid any kind of fraudulent practices, we are launching this tracking system. And through this tracking system, we are also providing this facility in the hand of public that they can, through this app, they can ask for the vehicle, they can also track their vehicle. Again, they will feed their mobile, because the mobile number is getting registered in the call center, and through this mobile number, he can track his own vehicle, that how much time this vehicle is taking to reach the patient's house. Because like our service provider is, he is saying that in 20 minutes or 30 minutes, they are reaching to all the site or to all the patient's house. But whether this is getting done or not, we can monitor all these through this tracking system. So this is some of the websites from that system which we are about to launch. So in the end, I would just say that yes, UP is taking a lead in using IT tools for different health sector projects, and I am hopeful that with your support and with maybe we will also be needing some private sector participation, because the number of projects and the number of PPP projects are going manifold. So I call all of the private sector partners who are here, that they can certainly be in touch with us, and whenever we need your support, we will certainly ask for it. So thank you so much, Alex, for providing this opportunity to showcase what is being done in UP. Thank you so much.